Yeast infection is one of the major problems a lot of women are suffering with, and they don't even know how to cure themselves from this yeast infection. But in this video, I'll be telling you the medications you can use in case you have been having stubborn yeast infection, as the name implies. But it's not stubborn. There is no yeast infection that is stubborn. Just that you might have not used the right medication you are supposed to use to manage that yeast infection. And that's why I'm making this video, to explain to you other medications you can use aside from the one you might have been using to manage yeast infection. But before we proceed, let me explain to you what is yeast infection. Yeast infection is an infection that is caused by majorly what we call Candida albicans, and it causes so many kind of signs and symptoms in the body. Mostly in women, you experience a discharge that looks white and thick but doesn't smell, but it causes itchy sensation around your private area. This is mostly caused by yeast infection. You might also experience discomfort while meeting your partner. As your partner is going in and coming out, you'll be having pains because it can make the lining of your V to be inflamed. It will make it to swell, and that's why you'll be experiencing pain while meeting your partner as a woman. Not just that, there are times where you might even experience bleeding while meeting your partner, and that's one of the major reasons why I'm making this video, to explain to you what you can use in managing this particular infection. Now, there's a medication we call fluconazole, which is the major medication that people use in managing yeast infection. Sometimes people use boric acid, which is majorly meant to balance the pH of a V, because yeast infection happens mostly when the pH of a V is not balanced. And most people use boric acid to balance this pH, which is very good, but you need to make sure you're using it under a doctor's guidance, because boric acid can be very, very corrosive. And boric acid is being inserted inside your V, not by mouth. Don't take boric acid by mouth, because if you take boric acid by mouth, it can cause kidney problem, it can cause problem to your heart and so many other organs like that. It can affect your liver, and that's why you must not take boric acid by mouth. Boric acid is being inserted inside the V. Now, there's a major medication you should use in case you have been using fluconazole, ketoconazole, nystatin, and so many of them, and it's not working. There is a medication that is meant to be given under strict doctor's prescription, which is called terbinafine. Terbinafine is a broad-spectrum antifungal medication that can help you in treating yeast infection without any stress, eliminating it completely from your system, and the health of your V will never remain the same. So if you find this video very helpful, please do it to share to as many people as you can. You might be saving the life of someone. And most importantly, don't forget to follow my page so you can get more amazing videos like this next time I make an update. I'll see you next time.